Worcestershire has 700 plus men diagnosed each year with prostate cancer. Yet our own support group only manages to recruit about 50 new members a year. What do the panel think? Do we need to approach these medical services direct with our marketing and flyer material? Or what other methods could they suggest to ensure men and their families have access to peer group support? Thank you, Gordon. So if perhaps, Paul, you'd like to start the ball rolling on this one?
Yeah, it's not good enough. I'm not happy with those figures at all. I think when Mary was embedded in our clinics, patients were getting flyers and booklets and portfolios about the support group very regularly. And I'm afraid it's a testament to the power of Mary that now that she's not part of the clinical team, we haven't seen the same penetration. So yeah, we have to work with our CNS group and our clinicians and make sure that awareness is out there. Obviously people have been very busy with so many other things to deal with. It might be something that isn't an instant reflex. So it should be a reflex. So when a patient is told, unfortunately, they've got prostate cancer, along with the relevant information around treatment options, etc., there should be a pack that we can give them, and maybe we could look to you to help us with that, creating either a digital pack, save the trees and the resources, or something, a QR code that they can scan that takes you straight to your website, and that's something we've been looking at with charitable funding. So yeah, it's educating the local team, and I'm sure we can improve that.
Yeah, one of the great values of coming to a meeting like this is you get other ideas, and this year there's been introduced a program whereby the GPs are following patients up much more, much with their prostate cancer on a regular basis. So there's a computer programs which will basically tell us when someone needs their PSA checking, and then we send people a text in our practice, and they fill in a form which outlines any symptoms they may have, but it means we don't miss PSA testing, which we used to in the past. But of course, thinking about this now, when we send that text, we could put this on the end. We could link to this, which I hadn't thought of before tonight. But that will be very straightforward. So.
Yeah, I was thinking about, so whenever anyone's diagnosed as GPs, we do have a conversation with them when anyone's diagnosed with a new cancer. So it would be helpful maybe to have some more information in the GP surgeries, for us to give patients, because they are coming in. That's normally a face-to-face conversation that we'll have with them. I appreciate, when they're given the diagnosis, but actually some patients, when they're given the diagnosis, they're really in shock and they're not able to ask, the questions, and then they come after, and sometimes they're quite specific questions, that they need to go back to the specialist nurses with. But, if we had some more information to give them then, that would be useful.
Thank you very much indeed.